from Novi Sad in oncology hospital. Told me there is 17% in the staff with broken DNA chain. It is a pre-cancer state for 30%
of the population.
Staff.
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 Uh-huh.
Staff in oncology hospital. Oncology hospital.
Okay. So when you had these first experiences with cannabis oil, as a doctor, I guess that was a shock, because that's nothing to do with all what you learned.
Yes, yes, it was amazing for me, so simple and so near us in the kitchen. We prepare remedy for cancer.
It's better if we have professional equipment, but it's
yes,
completely forbidden here. Even the testing, analysis of the oil for the people they are already using is forbidden in our country.
For palliative
yes.
Usage, what is known for years now, but you found out more after this experience. You had patients who literally recovered their health. Can you give us an example?
My friend had cancer of lung. It was like my fist. After 3 months of cannabis use, it was like a small egg. Now, now he's for 6 months without treatment except cannabis. He's very
taking
happy.
Only the cannabis, yes.
He's going in shop to buy bread because he's alive. But modern medicine hospital here in Belgrade said him, "It is the end. It is the end." It is his story. He went in one cafe nearby and saw 4 men's local mafia. They asked him, "Why did you so sad?" He explained them his own situation. What could we do for you now? Give me cannabis to try. Okay. They gave him cannabis without money, 16 grams.
Good gangsters.
Gangsters has soul, but our country is no soul. It is
Gangsters have more soul than governments.
So you said he had like big tumor, then the tumor
yes,
was just like
in half.
as a egg, and so now what is the situation of this person?
It is good situation. It is good situation. I see him in cafe. We talk. He laughed. He's very happy. He's alive completely. There is no difference between us.
And when was when doctors told him that he will die?
Yes. Doctors told him, do that what he did, without questions, without any questions.
So they agree with the way he feels.
Yes, they agreed.
The doctors, these doctors, they agreed with
Agreed
Serbia.
In Serbia we have actually 20 tons of uranium in the area. We have one upstroke of solid tumors greater than ever to now. have upstroke of auto-inflammatory disease, like Crohn, like lupus, have a upstroke of diabetes mellitus, multiple sclerosis, so on. In all of this illness, cannabis has a great part of healing this patient.
And I guess this kind of epidemic of cancer, I guess, comes from the bombing of the 90s.
Yes.
Yes, doctors even called it pandemic, not epidemic.
Pandemic, yes.
It's, yes, it's pandemia, not epidemia. It's so much cancer. Even every month in our club came parents for the babies with a tumor. The babies are born with tumor. And it's awful. I don't know did it happened before or
yes.
Very, very rare. And every month some of the parents come and ask how can they help with cannabis their child. And that's babies from 2 months, 3 months, 4, 6 months old. It's terrible. And they are treated with chemistry that destructs all their immune system, and we see that cannabis helps them too.
So now, as a doctor, it means that with no hesitation, you would recommend any patient who has any kind of cancer, any kind of tumor, you would immediately recommend not even to start with basic medicine, but just to start immediately with cannabis oil?
First cannabis. First cannabis.
Even for operations?
First cannabis.
Am I right?
At all, first cannabis.
Why?
Because
you, sorry, but
yes.
even though the classical medicine is not perfect, you have some cancers that can be cured with the normal medicine. So why don't you let them first go to the classical medicine?
From diagnosis of cancer to therapy, spent it a few months. Why should we lose this time? Why? Started with cannabis, and we follow that. We follow that for 5 months. If we see that it is good, continue that. Not use chemotherapy.
Yes, but how can we be, because some treatments, like classical treatments, can cure some cancers, some type of cancers. How can we, because you say that they feel better and everything with cannabis oil, but how can we be sure that it's really curing them and that it will be like a really long-term treatment?
We could follow that, and after 1 month we can explore situation like staging cancer. Why should we stay without treatment for 2 months between diagnosis to chemio?
The problem in Serbia is that patients are waiting even for chemotherapy, even for radiation, sometimes for months.
Why?
Because we have one of the worst medical systems now in Europe. In the last 2 years we was on the lowest place for the medical care and treatments officially. Yes, in private.
In private it is a different situation. I know a lot of colleagues who support cannabis in medicine.
And
a lot of them who's study, who's learn about cannabis.
Yes, that's good.
Yes.
That
Read
we need
read
more.
books. Try to find some the internet site to see that.
And so, since you started to be interested with this cannabis issue, how many patients you've seen in your hospital, just in your hospital, approximately how many patients you met who were using cannabis oil?
On my department, I saw 2 of them, but in my praxis, I saw about 10 patients. 4 of them has cancer, and 6 of them has other disease like chronic fatigue syndrome, post-traumatic stress disorder, multiple sclerosis, obesity, fatty man. It is good.
Helps a lot.
Yes, it's good for.
If women know about it, it will be legalized in a moment.
And so all these people that you met, for all of them, the cannabis was a positive experience, or did you meet people who had some bad experience with cannabis?
With my patient, patient who's used cannabis has a good experience about. Good experience, very good experience.
And so now you speak.